It's their Monday. And then we're back 23rd. Yes, it'll be the 21st. It's okay. Okay. Fill it out again. Yeah. And then it goes back to the department. Is that, or it comes back to? Yeah. The judge. And then the secretary. Yeah. Yeah. They don't have them. Yeah. Well, that it is. I know. I mean, smaller counties fine, but you know, just. What needs to be changed, and that's what the supervisors are working at. Yeah, I talked to Matt. If you have other. Yeah. Right, but they're over that, so but there is like, in fact, it's pretty good at violence. They wanted to. Because it's so high dollars. Yeah. Yeah. It's here. So we're there, so your Andres here. I'm here. Maybe. We don't have any replies. No more unless I come. Okay, so here we go. But usually it's not our way, so should we get started? Yeah. Nancy Borchard, we have not heard from, or Genevieve.
Good afternoon. We're trying to wait for a forum, but I think we're going to go ahead and get started because we have other things we can do that don't require a quorum. So hopefully we will obtain a quorum soon. We do have several members though who are unable to attend today for a variety of reasons. So this could be the faster meeting. Quicker meeting, I should say. Okay, I'm Cheryl Heitman, the chair of the board. I'll call this meeting to order and ask for the interpreter to give us his instructions. Thank you.
Good afternoon, everybody. Pleasure to be here. My name is Ricardo Garcia, and with me is working Gladys Ramos. So to access the interpreter via Zoom, after the host activist language interpretation mode, click interpretation. English and Spanish interpretation will be available. Click the language that you would like to hear, and it's optional to only hear the interpreted language. To do so, click mute original audio via phone. And your meeting controls tab more at the bottom right in the mobile app and top right in the tablet app after the host activist language interpretation mode. If the icon is not visible, tap the screen to make it appear. English and Spanish interpretation is available. Reminder, speak slowly, pause between sentences. Speak clearly, avoid interrupting or multiple people speaking, avoid using metaphors, acronyms, slangs, or idioms. Interpret signals during the meeting, speak slower, raise your voice, interrupt for clarification, or communicate a concern. Estos son los pasos para el acceso al intérprete vía Zoom. Después de que el anfitrión active el modo de interpretación del lenguaje, haga clic en interpretación. Y elija el idioma que desea escuchar. Interpretación en inglés y en español está disponible. Es opcional para solo escuchar el idioma interpretado. Haga clic en Audio Original y lo haga mute. En los controles de la reunión oprima More después de que el anfitrión active el modo de interpretación del lenguaje por su teléfono móvil en la parte inferior a la derecha de la aplicación, en la tableta, en la parte superior a la derecha de la aplicación. Si el icono no está visible, toque la pantalla para que aparezca. Un recordatorio, hable despacio, pausa entre oraciones, hable con claridad, evite interrumpir a varias personas hablar entre sí, evite usar metáforas, siglas, o modismo y doble sentido. Señales del intérprete durante la junta, hable despacio, alce la voz sin interrumpir para clarificación o para comunicar un problema. Thank you so much. Gracias.
Thank you. Okay, well, we do roll call while doing our introductions at the same time, so I'll start and then we'll move around this way. Thank you everybody for being here. Cheryl Heitman, I'm District 1 and I'm the chair of this board.
Janice Gardner, District 3, and I'm the chair of the bylaws committee.
Andre Bobro, District 1.
Nancy Morter, District 3.
Shanae Flores, District 1. Dalia Rocky, District 4.
Soledad Barragán, Distrito 5.
Great, thank you. All right, so we do not at this point still have a quorum, so we are going to move ahead, but there will be things we'll have to do an action on them. Okay, so okay, approval of the agenda. Now, that technically is an action item. However, I do have to amend the agenda. You should have gotten an amended agenda, but it was sent out late, so we apologize for that. Who's my report? Almost. But anyway, you should have gotten an amended agenda, and if you didn't, I will tell you what it is. Okay, so under new business, we left out what would be a public hearing for the collaborative care for youth, integrating collaborative and behavioral health models for comprehensive mental health services innovation project. And there's going to be a test on that. The 30-day public posting was supposed to be today, because if we have a quorum, we can't open the public hearing, but if we don't, we will be postponing it until next month, March 17th. So that people will have a full month to complete, and then it will come back to us. So I'm gonna just, anyway, that's on the agenda.
Well, okay, I have a question about that. We do have that.
Oh, we will. Sorry, Chair Piper, we will have 9 as soon as CJ gets here. So we will have a quorum.
Okay, good. So we will skip the approval of the agenda until CJ gets here. And then the minutes we have to skip until CJ gets here. So that's also an action item. And so we're going to go right to public comments. Any public comments from the, oh, good, please.
Okay, hi, I'm Maureen. Now that you said we can vote potentially, I wanted to introduce myself. I'm Maureen Hodge, Director of Ambulatory Behavioral Health and Grants at Community Memorial Healthcare. And I wanted to talk about the innovation grant that you're getting ready to hopefully vote on. As many of you know here today, the need for mental health services has been documented across all age groups in Ventura County, and even more is the demand to help children and adolescents. Ventura County, like much of the state, has a severe shortage of practicing child and adolescent psychiatrists. A total of 17 practitioners work in Ventura County to serve about over 187,000 children and youth. And Community Memorial Healthcare is a local system with 2 hospitals and 28 clinics, and we have 1 child and adolescent psychiatrist growing a child psychiatry residency program. You'll hear from Dr. Shaw here in a minute. While the issue is not new, strategies to correct the shortage are long-term, but relief is also needed now. And we're trying as a health system to really think innovatively, how do we help this crisis with children and mental health? Through this unique opportunity, CMH will simultaneously launch a collaborative care model and a behavioral health integration, evidence-based models. Both of them you can read, but when you get your packets. But the idea is to improve patient outcomes and satisfaction and at a lower cost. The intent is also to offer support for caregivers and parents of the children. So we're including the entire family in the models. We are excited to launch this pilot, and we believe, because we see it in our own clinics, that the need for providing mental health care through psychiatry and behavioral health are critical to the youth in our county. So I'm happy to be here today, and hopefully the form does arrive, but thank you.
Yes, thank you, Maureen, for introducing this. I'm Dr. Danielle Shaw, and I'm the lone child and adolescent psychiatrist at CMH, working part-time in a teaching clinic. So our hours to see patients are limited. So I'm faculty for the psychiatry residency program at CMH. And I also happen to be a member of the Youth and Families Committee with the Ventura County BHAB. I came to Ventura in 1996 as a pediatrician, fresh out of residency. I couldn't find mental health resources for my patients. Some of my patients saw adult psychiatrists who started psychotropic medicines, did not communicate with me, and the patients did not receive any psychotherapy. It was very difficult to find therapists who would see children. Then I have my own daughter who experienced her own mental health struggles. I was not trained in mental health as a pediatrician other than maybe ADHD and autism. So my pediatric training did not help me. Being a physician in the community did not help me. I didn't know how to support my own daughter. So I decided to go back into training in 2013 to become a child and adolescent psychiatrist. And during my training, I learned about this collaborative care model. It provides mental health care in the medical home where the families and patients are comfortable with their trusted pediatrician or family physicians. It's an evidence-based model. Health model where you do routine screening in primary care. It utilizes measurement-based care where people get better faster. We treat to remission, not just feeling better. And it's in a collaborative environment. The psychiatrist, me, and the residents I work with will work together with primary care who will prescribe the psychotropic medications for mild to moderate mental health issues. And I'm so excited to be back here because now my vision is coming to fruition for pediatric patients. We created a dream model for pediatric patients where they stay in primary care and we support the patient and the parent. I didn't get any support as the parent. I had to search for resources. So even now, we'll see patients in our psychiatry clinic, but we can't get them into therapy. A lot of patients need therapy and not medications. One of my colleagues who does something similar in Alameda County said that we should do skill groups. So we are going to incorporate skill groups. We're going to do psychoeducation to help the parents understand. And there's a unique model, reflective parenting. It's a theory of mind-based model. So parents can understand what their child is experiencing and have compassion. So I am just really excited that this is up before you. It's really exciting to see what happens. And it's not only the program for the patient and the families. I work with psychiatry residents and family medicine and just last week pediatric residents from Cottage Hospital. So these primary care residents and psychiatry residents are going to learn this model and can expand it throughout wherever they go and they practice. So thank you for listening to me.
Thank you. That's great. It's a very exciting program and it is it's so needed, but thank you for being. Other comments? Anybody? Any hands? Anybody else? Other comments? Okay. And I have I have an email that came in this morning from, Bob, and we will include that in our next communication with the board, so you'll still see it. And then I just received 2 letters from 2 8th graders from Hillside Middle School addressing much of what you all were talking about. And one is addressing mental health therapists and how important they are, and the other was addressing drug abuse and how important it is for there to be services for that for kids. So I'm gonna pass these around since we have them written, and you all can take a look at them, and then Jackie will include them in the records, so we'll have the record of those, and I will respond back to both of them. But it was very nice that we had them for a number of people. Okay, and okay, well that, Papa, we can start to the comments. Don't see any other ones? Okay, we'll have another chance later. Chair announcements. I do need to announce that James Espinoza, who has been a member of our BHAB, has submitted a letter of resignation, which we kind of expected. He is the executive director of a nonprofit that does receive funds from the BHAB, and we're going to be talking about this later with the WIC, all the WIC requirements and how that is going to affect our board pretty dramatically. But as you know, Liz Warren resigned last meeting, and now James has had to resign this time. We also received a letter of resignation from Chris DeHater, although I think Chris is intending to be here at some point today. But he also has tendered a letter of resignation. Same thing, he started a nonprofit. He is getting paid by, if you're getting paid by it, you're the executive director, you can't serve on the BHAB. Unfortunately, so that's also going to be Chris's position. Also, I wanted to bring your attention to, you should have received this. It's a call to action. It's in the back, but everybody should have received it. And if you didn't, please the public take these also. It is from our California Association of Local Behavioral Health Boards and Commissions. It's about a threat to Medi-Cal, and especially how this proposed cut, what it would mean to our community-based mental health providers, schools, counselors at schools, hospitals, psychiatric departments, et cetera, et cetera. So there is a group, and I think our professional association is involved with this. The Fight for Our Health campaign, we're asking people to join the Day of Action to Protect Medi-Cal for Kids, sponsored by the Children's Partnership, the California Alliance for Child and Family Services, Children Now, the California Behavioral Health Association, and the California Pan-Ethnic Health Network. And this is on February 27th, so it is coming up this week, and that's Thursday. The flyer tells you about calling into a member of Congress to let them know what your position is on these cuts and how this will harm people. There's a sample kind of script that you can use if you so choose, but you're certainly welcome to say whatever you want. Now, it's true that in this county, our member of Congress, well, both of them actually, will probably be voting against this. But I spoke with Congresswoman Brownlee just last week, and she said it's so important that she hear from people, even though we all know probably how she's gonna vote, because they do tally numbers. And it's really crucial that she can go and say, well, I had 5,000 or 10,000 or whatever of my constituents tell me this is how they feel about this. And that gives her something to also talk with her Republican colleagues about also. So it is important that we all take action. It's a simple thing to do. Just call in and leave your message. You can text it if you prefer, and you can email. And if you know, by any chance, if you have relatives or friends living in other districts, perhaps in other states, that's also helpful if they can get involved in this, because we just need to be a loud voice to try to keep this important and necessary. sure we're gonna be asked to do this in many things, but this is our first one. So if you don't have one of those, please pick one up in the back. Genevieve, yeah.
Thank you so much for raising that issue. I just want to say as a former staffer for Brownlee, like the office is really good about tracking and tallying, and if you do communicate with the office, you will get a written response. So when you say, or I used to say, I'll make sure the congressman knows if there's an actual human that's actually letting the congressman know.
Yeah.
So I understand that, thank you.
Thank you. Great. Okay, any other? Well, that's my comments. I'll move on. We were going to recognize Carol Shelton. CJ was bringing that forward and she submitted a wonderful recognition. But unfortunately, Carol Shelton's had a personal emergency and so she's unable to be with us today. So we will postpone that until next month and we will recognize her. Hopefully things will be better for her and she'll be able to be with us. But thank you for doing that and I'm sorry she's not here. But okay, we can move to the director's report and Dr. Jenner is not here, but you are, so.
And everything's okay.
Yeah, whatever you need.
Hi, good afternoon, Connie Moreno-Praz, I'm your assistant director here at Behavioral Health. I don't look like our beautiful director. She's busy offsite, but we also have our great staff here joining us in case any of you have any detailed questions, but first of all, we do want to note some important days that we are recognizing is for the month of February in your report. You'll see that we're celebrating Black History Month, Teen Dating Violence Awareness Month, National Eating Disorders Awareness Week, and then President's Day. So like I said, you have a lot of detail in our report. I'm just gonna do some highlights for you. And again, our staff are here. So our department, oh, by the way, I also want to point out that Dr. Dendry did a great job with a really nice short, but very important video that she's including on the attachment and also the newsletter. So you should, as part of your report, you have she's highlighting some of our initiatives, which are related to some of the reporting that we do here for you and other things that were involved in the department. As you know, we give you a very thorough report. Our department is actively working on many things and our job is to really focus on access to our services and importantly, quality of care for all our residents, our Medi-Cal recipients here in the county. So all of the initiatives that you see and other reporting that we do for you is critical for us to get funding for our county, to comply with the Department of Healthcare Services and any other funding sources. So our managed care operations, as you can see, is actively working on multiple initiatives. We're giving you some of these reports. We have for the project office has about 25 different initiatives. So we have we're keeping a little busy. No, we're very busy. We're proud. We're working on our TMS, our cranial magnetic stimulation, our SB43. You've heard about that. Our Prop 1. Or Proposition 1, Mental Health Services Act. We have a lot of planning meetings so we can get ready for what's coming. Very busy with quality assurance as well. They do a great job, not only responding to grievances and appeals on a timely basis, but to ensure that our clients are getting the high quality care. Definitely, almost everything that comes to the state, we need to have policy and procedures for just about everything we do. We are highly regulated. We also work with our managed care. We have the behavioral health care plan and we work with the health plans as well. So we're very busy with that. With our contractors, we're starting to have meetings with our contractors to ensure we're going through the scopes of work, the deliverables. And then if there's any need for any contract negotiations, then we'll work with our fiscal department and with our managed care operations as well. So our managed care operation also busy with utilization review. We want to make sure that we are reviewing our charts, doing peer review. Again, all about our clients to ensure that we give the best care possible. In our outpatient, as you know, with the restructure, we have the outpatient clinical operations. So we're proud to tell you that we've expanded our prevention and early intervention. I know you would be happy to. Prevention and early intervention, I know is one of I joined her in passion of us in behavioral health to do a lot of more work at the front end. So hopefully prevent folks from coming in our system so they don't stay here for a very long time. So we've expanded that. We're proud to announce and share with you. We have 2 new staff that have come to that unit to expand our outreach efforts. So I'm very, very proud on our substance abuse side as well. Also our Conejo, the Optimist, the Conejo Valley just had a forum. We have our great staff, Maria Di Batista, who was part of a great panel to address all the concerns and issues with fentanyl. Even though there is a decrease nationwide and we're hearing, don't worry about it anymore, no. Our kids and our communities, they're still struggling with the fentanyl issues, so it was an amazing forum. Our Youth and Family Services, very busy with our Mental Services Act. We have a plan, the 3-year plan. We need to spend all our money. We don't want to leave any money on the table that gets reverted to the state. So our team all of our staff have been very busy in enhancing our full service partnership program. So we're very busy in the children's and youth and the adults. We're gonna start seeing with older adults, with our child welfare system as well. So we're very, very busy developing those full service partnerships for our clients who need the highest levels of care. So I'm very proud, and Courtney has been a champion for us along with other people in this room, working with that. And then evidence-based practice is a big deal. All counties are being, required to really use evidence-based practice. What is the research and the science saying that works? And how are you using it? With which facilities are you using it? So we're glad that our staff are going to more and more trainings on evidence-based practices, and the report we share with you that we sent a group of staff to some of the evidence-based practices that we are going to be required to utilize as we move forward with more of our requirements. And last but never least is our very busy SPA unit, our strategy planning and administration. As you know, Prop 1 has all of us spinning. Every day we have workthroughs, we have meetings, we're planning, we're trying to get ready. We have more things that you'll see in the report. You've heard about BH Connect, you've heard about infrastructure funding, we had our BHAB application. And to keep you posted, Chair, we will not know anything on the application until May of 2025. But we are monitoring all those communications with the state. And we are, like I said, we are getting ready to work on increasing our access to our communities, our diverse communities, our Spanish-speaking communities, all the people that we serve, and to ensure that we provide them with the best quality of care in our community. Any questions?
Any questions or comments? Okay, well, I actually have some.
All right.
And hopefully Dr. Denner will do for each of us, but we talked about, I'm gonna find it. Oh, in your packets, in the end, are all the different kinds of programs. So if you look at this, it starts like this and it starts like this. It's a message from the director, and I guess we're not gonna see that. Is that correct? That's that little video.
Oh, Miss
Jackie, is that,
Jackie, do we have
that video? The
Dr.
message?
Dennerings?
Yes, that is on the PDF version,
No.
that I've been sent out through email.
Can we see it here? Just ask me if we can see it.
Oh, let me see if I can upload it.
Yes, like
Okay,
3 minutes.
okay, yeah, it's not very long, I think, but meanwhile, I know we had a couple comments from the community about, BH Connect. And I wonder if you could just very brief, I know it's early in the process, if you have somebody here that can.
Yeah, I'm gonna have Chantrice, would you like to come up on the BH Connect? She's like our expert, isn't she?
Can you repeat the question, please?
The BH Connect, just a real high level summary. She eats and breathes BH.
Excuse me, our interpreters would like to ask if we could speak a little more slowly, please. They're not getting everything that everyone is saying. And also if we could speak a little closer to the mics. Thank you.
Okay. Just a high level.
BH Connect is a new initiative that's part of CalAIM. So everyone's aware CalAIM rolled out around 2019, 2020, and we're still going. So this is its newest kind of initiative that's being launched by DHCS. And it is effective January 1st, but they're still coming out with a lot of the guidance right now. Excuse me. So a lot of the guidance we're waiting for from the state, so it'll be retroactive to January 1st, but eventually we will get some guidance as to what the requirements are. Excuse me. So one of the things that will be part of this is an incentive program. And so the department will be able to essentially meet some of the requirements that we are supposed to do for full service partnership and other evidence-based practices in order to receive additional dollars from the state in order to employ these programs. Another thing that will be part of this program is the IMG exclusion. So this means that if block placements have more than 16 beds, you can receive funding from the state for them. But there's additional hoops and joints and obstacles that you'll have to go to or reimburse for those services. And there's some other things that are coming down the pipe that we haven't quite gotten any guidance from, but the state will be releasing those sometime soon. They said before the end of February, but February's over this week, so we'll see if we get anything right. I think that's about it, but we're just waiting on additional guidance, and once we get that guidance, we can release more information.
So these, I'm sorry. So these programs that are ACT and FACT, those specific ones, all the ones that are listed here in the points, we're going to be probably participating in all that? In all those? Yes,
Because there's also overlap with Prop 1 as well, so it's really about timing. So in terms of when we actually have to go live with them, depending on what we're doing. So for Prop 1, that would be by July 1st, 2026. However, BH Connected might be sooner. We're still waiting on the timeline for that as well from the state.
There are some that are gonna be required. I know that clubhouses, I know San Diego County and others are very interested in that. And as she was saying, and it does cross over with the evidence-based practice with Proposition 1. So we're, as you're saying, as soon as we get those modules, those funds will be able to share more detailed information.
thank you. I think what the attachment is really helpful because it does take all of these different, we keep hearing about all these programs and it helps us, I think, to kind of, I'm gonna keep this because it's gonna help us to have reference point to some of these programs that are newer or they've changed their name or all these different things. So anyway, I know all the same time, I find it's crazy making for people, I'm sure. Jackie, were you able to pull up that? Oh, awesome. Okay, so thank you. Let's see a short video here.
Page 5 is gratitude and purpose. I want to take a moment to reflect on the incredible work you have accomplished and the challenges we face together. Your dedication to improving the lives of those you serve has been nothing short of inspiring. Each one of you contributes to making a meaningful impact, and I am deeply grateful for your compassion, commitment, and resilience. This year brings not only new opportunities, but also important legislative changes that will shape the way we deliver care. With the passages of Proposition 1, BH Connect, the CARE Act, Proposition 36, and the continuation of CalAID payment reform, we are seeing major changes to the behavioral health landscape and the new requirements for care delivery. Working together, we will ensure a smooth transition that aligns with our mission and the needs of our community. I encourage each of you to stay informed, embrace change, and share your insights as we adapt and improve. Training and resources will continue to be made available to support you in navigating these updates. And your feedback and experience will be crucial in shaping our approach. Looking ahead, I am confident in our ability to rise to new challenges and seize the opportunities this year will bring. Your hard work and dedication are the foundation of our success, and I am so proud to lead this impressive department. In 2022, as we embarked upon CalAID, I shared tips on compassionate management, something we all can do no matter what our roles are within BCBH. These include taking time to process your emotions, acknowledge what's happened, encourage self-compassion. Remember, stress is a normal physiological response to feeling overwhelmed and vulnerable. Bottling your emotions or expecting coworkers to do the same can be counterproductive. Pay attention to how you and others are feeling, and then move forward by discussing how you want to build a shared sense of purpose as a team. Visit our own Wellness Everyday website for tips on living your healthiest life. It's at wellnesseveryday.org. Today and every day, let's continue to support each other, foster collaboration, and prioritize wellness both for our clients and ourselves. Together, we can make 2025 a year of growth, impact, and positive change for ourselves, our department, and the community we serve. Thank you.
Obviously, that was a video that she prepared for the staff. But we thought it might be helpful and just informative for everybody to see it, to see kind of the culture that is going on here in this department and how, you know, there is so much going on, but the ways that their department is handling it, et cetera. So anyway, I hope that's helpful to you, all of us too, as we look at that. But again, having all of these programs outlined, I think is really very useful to us. Okay, any other questions on the director's report or comments? Okay, good. Board member comments and announcements. Any board member comments or announcements? No? Oh, Genevieve?
I just wanted to invite everybody to my Cox Annual Indigenous Knowledge Conference. It's gonna be April 11th at Oxnard College. And this year, actually, BCBH is supporting the event. So feel free to reach out to me if you have questions on tickets or whatnot. We're focusing on mental health. We're gonna have a youth track as well. So it'll be really exciting. And we'll be launching the workshops and speakers and whatnot. So, but save the date, April 11th, Oxnard College, at 3:30.
Great, thank you. Thank you. Any other board member comments?
I just have I have a question for Assistant Director Price. I wanted to ask you, have you heard any information about the wellness centers? And if they're going to be continued to be funded, if you know if they're going to be continued to be funded? That is a very popular topic in the next couple of weeks. And literally, we are scheduling a meeting with some of the leaders in the Office of Education. Because even our Latino community leaders are asking me about wellness centers, and they're worried about what they're hearing is happening or not happening. So I think by the March meeting, we have a March 5th meeting with the Southern Group, we should be able to give a better report back. But it is a very hot topic. Thank you so much. Thank you.
Any other board member comments? Okay, Cheryl. Oh, I'm sorry.
I just wonder if is it probably not the right forum, but some of our clients are also wondering if cuts are to Medicare or if they're on Social Security. And, you know, we know that many of those folks barely survive on what they get now. So if it was going to be eliminated or cut, do we have information about that now?
We don't have any information, but our doors are open. We are doing also a lot of outreach, going in, using our van, going to communities, working with the schools. We are, no action, no directive has been given to our department. So proceed as we're doing it.
As you know, the governor's budget was presented already, so whatever's in there, we know what that is, but I'm sure your question is more about what comes through the federal government, and
Yes.
and it comes, and I've asked Dr. Dittering that too, we've had discussions about that too, it comes through the federal money, government money usually comes to the state, and the state disperses it, so really, I don't think we, at the county level, really know specifically at this point, because we're kind of a trickle down, so to speak. So we will be finding out, hopefully it'll be good news, but that's why this call to action that we talked about, that's why these kind of things are gonna be so important, that we do make our voices heard for the importance of the continuation of mental health coverage and drug abuse, substance abuse programs for our county residents. Of course.
Yeah. I wanted to just share with you that internally, our team, we're working with Dr. Dennering to kind of mitigate. So what happens if they tell us this is ending on this day? So we are looking at all our funding sources. We're looking at all ways that we could provide services if this crisis would occur. Because as you hear the news every day, something's new. And it is true that the federal government is looking at a lot of the programs that some of our beneficiaries use. but we are trying to do some mitigation planning, so we will bring better information to this meeting.
I'm sure this is an ongoing process, so we're gonna just have to be flexible. That's what I think they're trying to do, but very difficult, particularly for our clientele, you're right, who are often low income, very dependent on these services. So yeah, it's a challenging time, and the department is being asked to go through already so much with all these other changes, so it just doubles on that. So I think we do wanna express also our appreciation as a board to the employees of our department, because they're taking on a lot of extra work, I know, and having to think outside the box and how to do all this reorganization. So if you could let Dr. Jenerick know also that certainly we do appreciate all the things that they're doing. Okay, old business, the data notebook is still in the process. Diane was unable to be here today, so I don't really have a formal report, except I know she's working hard on it. James was going to be working with her, as you know, but since he's resigned from the board, she's taking that on her own, which she'll get it done. And then, as you know, we do have 2 work groups, and I think both of them have started meeting now. So there's the crisis work group and the TAY work group, and I understand you both had productive meetings, sounds like, and good attendance, and really, this is where the bulk of our work is gonna be done, is in these work groups, for this season, for this year. So we appreciate you all taking leadership positions and, really everybody participating in their work group. I think that's really gonna be crucial for how we move forward. And I suspect that as they get going even more, we will have maybe a little bit less of the general board to do, although maybe not, but I think the main work is gonna be doing the work groups. Is there anything anybody wants to say about that? Don't have to. If you're not ready, that's fine. We'll just we'll keep in touch, and when you're ready to make reports back to the board, you will. Okay, great, thank you.
I'll say that.
Okay. Regarding the TAY work group, we had some great members on that work group. And we did identify some tasks for us to do prior to the next meeting, and we're going to have a special guest give us some information at the next meeting. And so we have not discussed goals or anything of that nature yet, but we had a good meeting. That's all I would say. Andre, did you want to say anything?
I'm not sure. Okay.
Or Dahlia?
Good afternoon. The crisis work group had a productive meeting as well. We identified, we didn't necessarily identify goals, but we identified kind of a direction or some topics to explore, and perhaps some tools or means to get to explore or investigate the issues that we identified. But we look forward to we're meeting again next month, and look forward to working together. And also we do welcome community participation. So thank you.
Great, thank you.
Sorry.
Tay does as well. So if there's anyone in the community that would like to participate, please let one of us know, or Diane McKay, who volunteered to chair. Thank you. Okay, well, moving on to new business. The first item is public hearing, which I announced at the beginning of the agenda. We do not actually have a quorum because unfortunately TJ doesn't count as a member of the quorum yet, because your reappointment did not come through yet. Yeah, so we can't yet apparently count you as we were hoping we could, but anyway, so what we're gonna do with that action item, which is number A, public hearing for the collaborative care, oh my gosh, this is a long one. Youth integrating collaboration on behavioral health models for comprehensive mental services innovation project. The 30-day posting will be extended. We will put this off until our next meeting, March 17th, where I'm sure we'll have a forum, and we can then open that time period at that point. But this gives you a chance to be thinking about all the things you want to comment on and all the things you want to. Okay, then our main discussion for today is the WIC code, and it was not agendized at the last meeting, even though we had just found out about some of it right before the meeting. So it is now obviously agendized and we're going to talk a little bit more about it. As you all know, you were sent out a copy and there is a provision in there that talks about the kind of membership we have to have, how many of this, how many of that, which is really important. And some communities, a certain number of family members, a certain number of consumers, a certain number of, a veterans person, somebody 25 and under, someone from the education community. So there's quite a few different, I might be not remembering them all, but there's quite a few different requirements. And on this kind of a board, when you're appointed by the report, we are appointed by the Board of Supervisors, but they have to try to also keep track of if we're meeting all these requirements because the state is now auditing this. So what we weren't meeting to begin with is, and it is in the WIC code, if someone on our board is an employee by, well, let me start again. If someone on our board is a member of a nonprofit, for example, this is one category, that does receive funding from the behavioral health department. If they're in a position of the executive director, leadership position where they make the decisions and they're getting paid, they will no longer be eligible to be on this board. Ironic as it seems, because those are the people who often have the best knowledge and information. If they are, but there was one exception in 2015 that said, if you are actually working, I think it even includes working for the county, is that true?
Yeah.
Yeah, if you. Oh, sure, that's great, if you have it in front of you, great. Marty's our county council representative.
Okay, so in your packet, just so everybody can follow along and you don't have to listen and try to memorize it as I say it, in your packet, right after the memoranda about specific contracts, there's a page that's entitled up at the top. It says BH WIC, page 3. Everybody got it? Okay, so you go to the right-hand side column and you go about halfway down, you see E1. And then it says, except as provided in paragraph 2, we'll get to paragraph 2 in a second. A member of the board or the member's spouse shall not be a full-time or part-time county employee of county mental health and substance abuse disorder service, an employee of the State Department of Healthcare Services, or an employee of or paid member of the governing body of a mental health contract agency. So unless you meet the exception, and you're disqualified by either you or your spouse, meeting the criteria in E1, there's an exception in E2, which says a consumer behavioral health services who's obtained employment with one of those employers that would have been a disqualified employer, and holds a position in that consumer in which the consumer does not have any interest, influence, or authority over any financial or contractual matter concerning the employer, may be appointed to the behavioral health board. And then if you meet that qualification, that you're safe by that exception, there are still limits, so you can't vote as a member of the BHAB on anything related to your employer, which that paragraph makes sense. And I think just generally, B2 was to recognize how difficult it is sometimes to get folks who recognize and identify as behavioral health consumers to be members of this board. But what it says is a consumer behavioral health services, and that's the exception. And then again, you have to show that you're not related to the finances of the disqualified employer. So there were a couple of individuals who didn't pass that criteria. James was not actually one of them. James's resignation was based on his own personal activities and didn't relate to this.
Well, actually it did though, that's how it started, because he did apply for a grant and he got it. from the behavioral
No,
health board?
he does not have a grant at the moment.
Oh, he hasn't been issued the grant,
He
but he
does
was, yeah.
He does not have a grant.
Oh, okay,
So this, he was still, so,
okay.
yeah, I've read both resignation letters, either one would talk about this.
Okay,
So,
interesting, yeah.
anyway, so is there any questions? So we were in the process of putting this into the bylaw.
Right.
And then, Teresa from the state organization had a conversation with somebody and recognized that they were, you know, they were disqualified by this and kind of you know, raised that before we got the discussion of the bylaws, you know, updated, you know, everything according to the whole point. So that's about it.
Yeah.
Anyway, any questions you have?
Sure, let me just, oh, I'm sorry, let me just clarify a couple of things, yeah. So, I did talk with Teresa a couple different times over the weekend and she's, was pretty clear on a couple interesting points. The first one is our county and Los Angeles County are the only two counties that were not in compliance with this particular provision, according to her, of all the other BHABs in the state, which is kind of remarkable, I think, but that's what she said. Anyway, so if you, again, if you are sitting on a nonprofit, this is, I think, where it kind of gets into some of our members a little bit more. If you're sitting on a nonprofit board, the nonprofit board gets funding from the behavioral health department, that's one thing. But if you identify as a consumer, that's your own self-identification, then you are exempt. As long as you're, I think, not the executive director of the nonprofit board. So that was her interpretation. Now we subsequently, Matt Revere, who's our supervisor rep, who wasn't able to be here today, he has asked that the chief, I don't know what you call it, county council writes an opinion for the entire board of supervisors so that everybody's on the same page on what really this applies to and what it's going to apply to from now on. So we're also waiting for that to come down. I was hoping we'd have it by today, but it didn't happen. So they were kind of in a budget. So might not even wait, but anyway, so, okay, Andre?
Thank you. I would like to know, how long do we have to fulfill these requirements and to appoint, new members to the board such that we have a full complement of board members?
It's a good question, and we are, as you know, appointed by the board of supervisors, so it's really up to them how fast they do this, but I think most BHABs, and I think we've had this process also, we try to help them by recommending people who we may know in their districts, who may actually meet some of these qualifications. So, and you bring up another point that I was gonna make too, that this board has had, you know, we've got some new people, we've had a lot of turnover, now we're gonna be losing people because of this particular item, and so it would be helpful if we could all fill out again kind of a introduction sheet that, is that what you would call it? That goes to the supervisors, or the supervisors actually have this and they're supposed to give it to you if you're gonna be a new member. I don't know if they all still do this. I think it's kind of a practice that it's kind of maybe gone by the wayside a little bit. And so the department doesn't feel they necessarily have an updated roster either on different categories that someone may be able to fulfill. And so what I'm gonna propose, and I think Dr. Jenner and I had talked about this, is asking everybody to, and this is totally voluntary, just want to stress that, totally voluntary, but if you wouldn't mind filling it out again, if you've already done it, or filling it out for the first time, it's a simple form. It would help us to kind of see where we are in terms of, we have just so many consumers, so many family members, now we have just so many 25 or under, a veteran rep. Anyway, all the other things we know. But anyway, we have to have all these, and it's a tricky thing. The one person can be more than one thing too, one category. We have to look at our county, see what the ethnic makeup is, try to balance our board as much as possible with that also. So there's a lot of things to consider in these appointments, and that's why it's really crucial that I think we help the supervisors to find people who want to be at a BHAB, have some knowledge. This is, you know, they have something
a lot to offer. I mean, all of us have a lot to offer, but in terms of what their different categories are. So we just need to kind of look at that also, but the time, there's no time limit. It just means that we are limited sometimes because today we couldn't make a quorum.
Well-
Because, and if you have fewer members, then you have a lower quorum, but still, yeah. Michael?
Oh, actually,
Okay, so we have some news.
I was sharing this with Janice, according to each of the resignations, I'm showing that we have 15 members of BHAB, which means a quorum is 8.
Right, so because CJ cannot be counted
There's
today,
15, CJ wouldn't be part of the date, it would be there as it comes through.
so that means we do have a quorum.
You have a,
Is that right, Jackie?
There's,
Okay, good, okay, that's great.
I mean, technically that would be correct, Marty, is there anything? Or not? Okay, then yes.
Okay, so we can,
Great.
we can address it.
Okay.
Yeah,
Yeah, then we'll go back in a minute to get this.
Yeah, go ahead.
May I go back to, may I make a comment? So what we've done before, and I was thinking that we might want to do this in March or whatever you, Dr. Jeremy, decide. When we had a lot of members in attendance, hopefully we will, we did an anonymous piece of paper. It didn't have our name on it, and we just said, family member, consumer, and whatever other category we feel we might fit into. And then we just, I think Jackie collected it, and then I don't know if we had what we had, but we had, and we went all around the room so that we could actually identify it without naming names. Because it can be anonymous, a lot of people don't want to identify if it's not anonymous, so, or however you would want to do it, if you have a form. But let's do whatever. Thanks.
Okay, so however we might be able to get the information, I think it's kind of where the point where we might really need to do something to kind of be able to self-identify. And again, it would be completely voluntary. And you might want to look at the WIC code yourself, or you have it, obviously, but for example, veteran representative, which I thought was good, I didn't pick this up before I read it again, can be a spouse or a child of a veteran, as well as veterans. So I'm sure many of us, or several of us, would qualify for that. So my husband was a veteran, I should say, still alive. And so that qualifies me, for example. So there's ways that we can, I don't want to say we're gonna shortchange any group at all, but then we just have to be aware that we're also representing that group. That's what we self-identify as. So, and consumer does not have to be a current consumer. It can be somebody who's been a consumer in the past. And it doesn't have to be of just a county facility. And I think that's a big thing, because people think they think when they're gonna identify as a consumer, they have to come to the county behavioral health department or the SUDS programs. And that would be preferable probably, because we would like to have that information, but it's not absolutely mandatory. So just to keep that in mind also. Any other questions on this? Yeah, Genevieve.
Thank you, Chair Hyman. I have a question that's very specific to me, and I don't know if now is the time to ask it, or I should just email council.
I'd be happy to talk to you after we're done here.
Yeah.
Today.
Why don't we do it? Is that, can you say?
Yeah,
it for-
I can say, I'm also happy to ask him.
Yeah.
Real time, like I don't want to shy, but I just want to make sure it's squeaky so that everyone knows this time.
Yeah.
Thank you. And I guess maybe separately, kind of with my school board trustee hat, having an educator here is an interesting concept, because don't school districts get money for their wellness centers from kind of behavioral health? So.
No?
So it's all from BCOE, right?
We're passing.
But still, it's still funds from BCBH, from BCOE, right?
Actually, that is a mystery. I did talk to Dr. Dennering about, there's a little bit of confusion about us funding the school wellness centers. And that's the meeting I was talking about earlier. We'll be doing an accurate report in March, because there's a lack of clarity there. There's confusion, because we do not fund them. And the past, according to Dr. Dennering, there's past grants that we would have passed through. And I think there's confusion in the community that we still are, and then we have some oversight over these wellness centers, which we don't. So if it's okay with our chair, person, we would bring a complete update next month.
I appreciate that, because again, that would also cause like another conflict, right? Because my understanding is that wellness center funds come from the state, but even if it's a pass-through, my understanding of the WIC code is that would still count as like a contractee relationship with the wellness centers. And again, I understand that there's no oversight from BCBH of the wellness centers, they're run for the districts. But I just wanted to uplift that it'll be hard to get an educator or someone from the school district. But thank you for the clarification.
But if it's sorry, one consistency. Yeah. So I know we have our county council here, but the previous experience I bring is that an employee of the education department could also not necessarily having any contractual agreement with us. So again, just to clarify, currently we do not oversee the wellness centers in the schools. So once you describe your situation, but we'll bring an update on next month.
No, I understand that, and I'm not here with the school district, I'm here with my nonprofit, so thank you.
Yeah.
But you could be an education person if that was the case, because you could have more than one. That's the thing, that's what's so important for us to figure out. Because if we're gonna have a smaller board, for example, or we're gonna have it's gonna be taking a longer time to get a full board. If we have people who can fill in for more than one, population, that would be fabulous. So that's another reason it's important, I think, for us to kind of see where we are in terms of where people are willing to identify. Are there any other questions about this? And this is an evolving situation that may affect other people we're not even knowing about yet, and it could potentially reduce our board even more. It's interesting, I looked at the work groups and they're both still very even. There doesn't seem to be, even though we've lost a couple people, it seems like they're still okay in terms of the numbers, so. Okay, with your permission then, well, I'll just finish this and then go back to the items we can vote on. Okay, presentation requests, we do have a request from the TAE committee, which we will be bringing forward as the presentation in March. And that is to look at what the TAE services are that the county department does provide, and any other services that perhaps they contract with know about. And also there was what's the title of the public?
Patient navigator.
Patient navigator, thank you. There was also a question about who is, or not who is, but what is the role of the patient navigator in the department? Because we had worked on that, I think, about a year ago on this board. And so it's good to have kind of a reminder of what happened with that. And there is such a person, and what is their responsibility. So that will also be part of that presentation. But if you have other requests or presentations, be sure you let Jackie and myself know. And like I said, we are gonna have actually next month, we do have two people we're recognizing. One is Carol Shelton, who was unable to be here today, and there's another woman that I'll be bringing forward who's a member of the Ventura Police Department, who did a very heroic thing, working with a young man who was on a bridge, ready to go, ready to jump. And she spent 3 hours with him and was able to find out which bridge, because there was miscommunication on where he was, and track it and finally get an officer out there to help him down. And he's very, she'll tell you the story, it's very moving. He's very appreciative of her efforts. It's really neat. So she'll be here. She tells the story. It's great. Okay, moving back, we can now approve the agenda. Ironically, which we're almost done with, but we're not quite done yet. So, Michael's on the room. All right, okay, all right, I'm not going there yet, okay, so we're going back to the contracts. These contracts have actually already been acted on by the Board of Supervisors. We get notified of the contracts. We don't actually have to take action on them, but we can ask questions. And if we have concern or questions, then we can go back to the Board of Supervisors with that, but we don't actually vote on it. So, but we appreciate you all being here. Tell us about yours. Michael's back. Okay, I'm gonna finish this. Okay, so were there any questions or comments on those two contracts that are listed? Andre?
Thank you. I'm a big fan of the Family Justice Center, and it looks like this is a new program. I just went on, just on their site to see if there's something new and great. I didn't see that. I can contact them to find out what this is all about, but does anybody here know about the just brief description of this novel program?
Anybody? Do we have anybody, is that MOU? It says it's MOU with the DA's office.
Katie, we don't, is it, it's in there, it doesn't outline it, what's in there, but it's not outlined.
It describes its purpose, which is great. It just, it doesn't, there's no description of the actual program. And again, I could contact them directly. I'm just curious if there was somebody within our group that had an understanding.
I'm sure there is, because it's an MOU, they apparently are not here, but we can certainly get back to you, whoever's in charge. Well, the staff will get back to you. Okay, thank you. Anything else? Okay, now we'll be back. We're going back to the agenda. Approval of the agenda, which we're almost done with. But we still have to, with the addition, and that way we can open the public hearing too. All right, so entertaining a motion for the approval of the agenda as it was amended.
I'll make a motion to approve the agenda as amended.
Is there a second?
Second.
Okay, thank you. Been moved and seconded. CJ, do you have the roll call sheet or?
Sorry.
Oh, Candace?
Do I have it? Yeah, I have it.
Okay. Do you want Janice to just call it, or you wanna? What do you want? Somebody has to call the roll.
Janice, I'll call the roll because officially a board member has to call the roll.
Yeah.
Okay, Soledad Barragan,
Yes.
Andre Bobra,
Yes.
Nancy Borchard,
Yes.
Genevieve Flores Hara,
Yes.
Janice Gardner, yes. CJ Keavney, oh, sorry, CJ. Okay, Dahlia Rothkin.
Yes.
Michael Rodriguez
Yes.
and Cheryl Hyden.
Yes. That motion passes. And now we will move to the minutes from the last meeting, January 27th. Anybody have any additions to the minutes or corrections? If not, I'll entertain a motion to approve the minutes.
Move to approve the minutes.
Thank you. Second, Nancy seconded. Hey, Janice, you want to call the roll again, please?
Soledad Barragan,
Yes.
Andre Bobra,
Yes.
Genevieve Flores Hara. Yes, myself, yes. See, Dahlia Rothkin,
Yes.
Michael Rodriguez
Yes.
and Cheryl Hyden.
Yes, that motion passes. Okay, now we can go to, under new business. A public hearing for the collaborative, oh my gosh, I'm not reading this yet, okay. That big public hearing for the collaborative care for youth, etc. Which you have on your packet, we can now vote to open that public hearing. Until February the 20th. Oh, this is February. We can open it for a month, I think, 30-day public hearing period.
We need a motion. I'll make a motion to open the public hearing of the collaborative care for youth, integrating collaborative and behavioral health models for comprehensive mental health services innovation project. The 30-day public posting was extended by 1 day and will remain open for the comments until February 25th, which is today, as our lovely chair said, 2025.
Tomorrow.
Okay, tomorrow.
Yeah. Okay, there's a motion, is there a second? Second, Genevieve? Okay, great, thanks. Okay, again, Janice, roll call vote.
Okay, Soledad Barragan,
Yes.
Andre Bobra,
Yes.
Nancy Borchard,
Yes.
Genevieve Flores Hara, yes, myself, yes. Dahlia Rothkin,
Yes.
Michael Rodriguez,
Yes.
and Cheryl Hyder.
Yes, thank you, that motion passes. Okay, I want to just say to everybody, we do one more public comments, which I'm gonna get to in a minute. But I want to just thank everybody for this was a rather disjointed meeting because of a lot of different things going on. I want to apologize for that, but it's what happened, and we got through it. But just to make it even more confusing, I forgot one thing, which I'm gonna now bring up. So because James Espinoza resigned, he was our second vice president of this board. So we have to then determine about appointing or electing another member to serve in that position. It really helps that our executive board is filled out, because otherwise it's very difficult to make quorum. If you're missing one person, you're kind of, you know, that really is a problem. So what I'd like to suggest, because it isn't on the agenda, is that if you are interested in serving from now until, it's just until July, when a new board will be elected, not board, sorry, officers will be elected. If you're interested in serving until then as the second vice president, which the duties of such are basically to help Diane do the work, data work group, which she is working on. You, I don't think you'll have to do anything on that. And then just to be a member of the executive board to help us with all decisions that we make. And if for any reason myself or Diane were not there, you'd be running the meeting as the second vice president. So if you're interested in doing that, it is an additional meeting, and unfortunately it cannot be on Zoom. You can Zoom in if you have to, if you have meet one of these criteria, but it means we might not have a quorum. So although we don't take a lot of action on them, so that probably isn't so important, but normally we do meet here on the second Monday of the month at 2:30. So if that works for you, you're willing to put in that additional time, we usually only meet for an hour. That would be great, and it really is helpful just to get kind of organized and see where we're going, that kind of thing. So if you can, great, just let me know. If not, I will have some process to do this by the next meeting. Okay, any other additional public comments? Anybody? Oh, Chris? Sorry, come in, thanks.
Hi, everyone.
Hi.
It's nice to see everybody, and thank you for letting me make this public comment. I just want to express my gratitude for serving on this board it's like now it's like 3.5, almost 4 years or so. And there's so much that I've learned, and so many amazing people that I've had the opportunity of meeting and working with, and the introduction to so many different perspectives. And I really just appreciate it. And I'll make this short because I'll always be around. But I just wanted to say, you know, reflecting back and looking at where I started, you know, that's a few years ago, cycling through the justice system and seeing things firsthand, and then being appointed on the board, and then having the privilege to serve on this board for those years. It's really given me a great perspective on everything that Ventura County Behavioral Health does, everything that the community-based organizations do, all of the other community members, the family members who help the individuals, you know, that are affected by SMI. All the time and energy that's spent on the contracts and on the work and sitting with people and in the clinics and all of that work too, you know, the work that the jail staff does, contracting through WellPath and helping in the growth of the TIMU, all these things that we've seen over the past few years. I've just had an incredible privilege to be a part of that, and I sincerely thank everybody here. A little anecdote, stepping back to when I first started. My big thing was I wanted to address the safety rooms in the jails, because as somebody that's gone through the justice system and experienced those firsthand, I think that isolating people that are in that place, while it's good for the safety and the health, you know, because they need to be in a safe environment, it's maybe not the best thing for when they're in that mental headspace. That aside, I quickly learned, you know, starting with the board, that we're going to do so much change and things would happen so quickly and things would, you know, would just happen overnight, right? Because that's the way that I wanted it to happen. And then I slowly realized these things take time and effort and diligence to slowly make that change over time. The other piece is I had the privilege to, with a few other board members, started a nonprofit a few years ago. And I thought that was the way to make things happen quickly and the way I wanted them, and everything happened overnight. And then I realized, okay, these things that this board is working on, these things that the community members are working on, they take so long and so much work and so much effort over time. And I just sincerely appreciate all the effort that everybody takes to make that happen. And I will continue to be around if we're doing some great things with the nonprofit that I'm gonna definitely share with you guys in the next upcoming meetings, and I just appreciate the time that everybody takes to work on these things. So thank you. I hope that's my 3 minutes. Thank you.
Well, thank you, Chris. Yeah. You've been a terrific board member, and I think, I can speak for the board to say we're gonna really miss you. You've, contributed a lot. You do have, a perspective that's unique, and you are very open about it, which is terrific. And, I've learned a lot from you. So, it's, we're gonna really miss you, and I'm sorry that this provision in the wood code sort of forced you to resign, but I'm glad to know you'll still be around and you'll still be coming and sharing things with us, because that's really, really important. So thank you. Anybody else, Michael?
Chris, thank you. I've had the honor and privilege of serving on this board with you. I appreciate when we were working together, when you were first vice chair, when I was chair, your insight and work were invaluable. I also truly appreciate, one, that you always approach things with an open mind. We were always, curious. And irrespective of where different perspectives were, or positions or opinions were, you were always willing to express yourself and articulate in a respectful manner, and respectfully listen to other perspectives as well. And, I think it holds true with what I hope I practice, what I preach, is in that I honor like everyone's different perspectives here, because hopefully all these different perspectives enrich in our informed discussions. So you've been a consummate professional as a board member, and I mean that in like the truest and most respectful sense. So I'm miss working with you on this board, but I just dug up a letter, so I have a couple questions for you afterwards on how, I can partner or collaborate with your organization. So thank you.
Yes.
I just wanted to say, Chris, how much I appreciate all of your input, all of your fabulous ideas, your perception, your insight. From the first day you joined the board and we did our orientation at Starbucks to, today when you are sadly resigning from the board, you've just been an inspiration to us all, to myself when I was also chair, and all the committees that you worked on, and all the great information that you brought. And I just really appreciate everything you've done, and we thank you so much for all of your participation in every aspect. Thank you.
Nancy?
Well, I too share everyone's comments that have been made about Chris. I admire you very much, and I love working with you. You just always say yes, and you said yes so many times, and I know you were really busy. And so it makes me very sad, this meeting, to lose so many good people. I guess we can't do a thing about it, but it's extraordinarily difficult. And when we have excellent people that we know can contribute, and then for some little comment we can't, it's really an aggravation. But anyway, I do love it that you came, Chris, gave us a chance to say goodbye. And we hope to see you very often. Thank you.
Thank you. Anybody else? Oh, I'm sorry, Liz. I think that's your hand, right?
Yeah.
Yes, thank you. Thank you, Cheryl. Chris, I'm going to miss you terribly. I want to thank you so much for the integrity and empathy and collaboration and inclusivity you displayed as a member of the board, and also the leadership that you had with the Adult Services Committee. You've been an absolute pleasure to work with. And as someone walking a similar path, as a fellow peer, you are an outstanding recovery role model for our people, and your willingness to be vulnerable and to share your story in such a open and honest way just sets the bar extremely high for all of us. You are just an extraordinary human being. And the fact that I knew you before you were married and had a baby, and now you're leaving us with your own nonprofit and a family just shows that your recovery journey has been exemplary. And it's been a privilege to serve with you and to call you my friend. So thank you.
Thank you. Anybody else? Well, we're going to miss you. I think you got that, but we will look forward to all the good things you're going to continue to do. Yeah, and Nancy, I share your frustration. I think when we have to say goodbye to so many people like this, it really is frustrating because it disrupts the board, it disrupts the work we're doing. And we have such good people, and to lose good people is really, well, it's almost criminal. Yeah, but anyway. But we do still have lots of good people on the board, and I just want to emphasize as I do adjourn, it makes it even more important that all of us show up as much as we can. I know things happen and we can't always get here, but if we can, it's gonna be really, really important because the smaller the board is right now, as we have lost people, it makes it more important to get that quorum so we can take more action. So I hope everyone will make a real effort. And also, if you look around and you see people who you think would be good candidates for this board and knowing kind of what we're looking for, please let us know and we can work with your supervisor, or you can work with your supervisor. I don't know if all the supervisors are affected, but we can also look at that, who's down on in terms of, we already had a couple vacancies, so there are some that will be more affected than others probably, so we'll look at that also. All right, anything else from anybody? Okay, I'm gonna adjourn the meeting and we'll meet on March 17th is our next meeting. Thank you all for being here.
Thanks, Sharon.
Thanks.
Who has, excuse me, who has the letters from the kids?